Hey guys, we're here for another episode of Nurses Outside the Box, episode 31 already with David Sanchez. He's a nurse. He also has his own digital media company. So a whole different ballgame. Very welcome, David. Welcome to the show. So good to have you.
Thank you. I'm excited to be here.
Yeah, you are a nurse outside of the box. I will tell you that. Totally,
Yeah.
Right?
Yeah.
So let's dive in. What makes you a nurse outside the box?
Well, there's a lot, man. It's been a crazy adventure. Let's see. I started my first business in 2014, so it's been 6 years. But man, it feels like a lifetime. It feels like 20 years. I'm still pretty young. I've been a nurse since 2009. So, do you want me to go into the whole story, or?
I'd love to go into the story, but I think one thing I would love for you to come out first is that you really do work as a nurse still, right? And you have your own media company. So let's. But I'm curious. Why in the world did you do that? Why in the world? I mean, we're going to go into the whole story, but what made you really go and say, "Hey, I'm going to start my own media company or my own digital media company"?
Yeah, that was more of a need-based thing, just because it actually started with the nonprofit. So just wanting to be able to help people struggling with addiction, I started the nonprofit Addiction Treatment Center, and from there, I really needed help with digital marketing. And the need was there. I couldn't find anybody to help me. So I had to get a team, learn how to do it myself. And that's how we started the media company.
Wow. Okay. So dive into the story. How did you get here? What is your story as a nurse, as a person? I'd love to hear.
Okay. Yeah, sure. Yeah. So I became a nurse in 2009. It's weird because my mom always says I was supposed to be a nurse. I guess my dad was dying of cancer when I was born. My mom was in her late 20s, and luckily he was able to survive miraculously. He's had 2 other bouts since then with non-Hodgkin's lymphoma. But all 3 times he ended up in ICU for extended lengths of time. He was on a ventilator a couple different times, and he survived every time miraculously. But basically, my first few years of my life was in and out of the hospital, not as a patient, but at the bedside with my mom taking me and my brother, who was like 2 at the time, to go see my dad, who was in the hospital. And so she was like, the nurses were always holding you. They always loved you. And so I don't know, maybe some of that caught. Maybe it's contagious. But anyway, so that's a side note. But I became a nurse in 2009, started working in the emergency department. I really loved, I was like, I want to work in either surgery or cath lab or the ED. And so I went into the ED and I loved it. I was working in Phoenix. I was surprised how many overdoses we were getting, or how many people that really just wanted help with their addiction, and they just didn't know how to get help. And really most facilities in my area, I'm in Northern Arizona in Prescott, and most of the facilities in our area just were either very, very expensive, or you had to have great insurance. And unfortunately, that's just how most of the industry is. And so I really wanted to make a difference. And so my church actually donated the money for me to be able to, basically as an angel investment, for me to be able to start a nonprofit to be able to help people. So I started out as a sober living home. Quickly, I realized people needed more help. And with having a healthcare background, I was able to say, you know what, I need to figure out what kind of licensure we need, what kind of resources we need as far as staffing goes, to be able to help people, because so many people don't take that leap to find help just because they're so afraid of feeling sick and the withdrawals and everything. And plus they needed help with counseling to really dig deep into what their issues were that were motivating addictive behavior in the first place. Yeah. So within less than a year, I would say a year. Yeah. Right at it was less than that. About 9 months after we opened the sober living home, we went ahead and opened our clinic. So we were able to offer outpatient detox, with a clinic, with medication management. So we had a medical director, a lot of staff. And we were able to help people. Yeah.
Did you expect it to go that quick? Because that's very quick.
No. It was just there was such a need. And of course, people can't afford to pay a lot of money. So we're like, well, why don't we create a facility so that way we can build their insurance, and that way they can, have some sort of affordable care and find help. Right. But then most of our patients were coming off of Google, which was wild. I didn't expect that. Most of the people were finding us online, and we just had, I bought I hired a guy to do a freelancer to do a website design, and pretty soon I found limitations. So I hired an agency to help us to maximize our online presence. I just wasn't getting the results. It just wasn't working out well. And so I was like, gosh, I need to fire the agency. They're just not doing a good job. I had already hired a social media manager and a videographer, and I started learning a lot about search engine optimization and other types of digital marketing. So I was like, well, let's just start my own agency. That way the nonprofit doesn't have to pay for all these marketing staff. The agency can do that. And plus, if we can do a great job for our facility, which turns out the drug rehab industry it's the most competitive specialty in online marketing. So it's crazy. So I said, if we can do a great job with that, why not, help other healthcare facilities too with the same stuff, because it's actually going to be easier. And then that'll be able to cover the cost for us to be able to promote the nonprofit. So that's how I started Digitalis.
Wow. And all the while, were you still working as a nurse, or was it taking all your time? What were you doing at the same time with nursing?
It was taking the vast majority of my time. I still stayed on as a stat position, or, PRN, per diem, whatever you want to call it. So I was doing on average between 2015 to 2018, I did an average of like 1 day a month.
Okay.
So it was something. I stayed active with my ACLS, PALS, and TNCC certifications, but I was doing the bare minimum basically, just so I didn't get too rusty. I don't know. I always felt like I really needed to keep a connection with the bedside, with providers and patients, and really just to have a pulse on what's going on, because healthcare is always changing,
Yeah, totally. So what's happening in your world right now? What are you doing right now? I'm curious. So you went into more of digital marketing. Is the nonprofit still existent? What are you doing with both? I'm curious.
Okay. Yeah, I went more full-time focusing on the media company. We call it a growth agency. That was at the end of 2018. So unfortunately, everything is not sunshine or rainbows. If anybody works in substance abuse or behavioral health, that reimbursements are a huge problem. Billing is always a huge issue. So I ended up having to close our program. Even though the nonprofit is still intact, I ended up having to close the program at the end of 2018. That whole year, we had spent a lot of time and a lot of money trying to salvage it. But just the way the business model was designed, there was no way to be able to know whether you're going to get paid for the services you're providing if you're billing insurance, unfortunately, without making it a massive, like public payer funded facility like Medicare and Medicaid. Mm-hmm. And I wasn't ready to take that leap. It was just too money intensive. I couldn't afford it. Mm-hmm. So we ended up closing. We had a men's program and a women's program. So a house for men, house for women, our clinic, mm-hmm. taking up 3 suites. We had 20 employees. Wow. It was very tough, but it was something I needed to do. I tried to salvage it that whole year, and it became clear over time it's not going to work out. So
right, and that's what we do, right? Yeah.
Yeah. So I talked to the board and I said, you know what? I tried so many different ideas, and I mean, once you start becoming an entrepreneur, you get ideas like crazy. If I sit for 5 minutes, I'll get 30 ideas with new businesses or new ways to make a business work better. And so I tried all these different ideas, but oh my gosh, it became clear eventually, this isn't going to work out in this structure. We're going to have to revise it. And we just don't have the runway to be able to make it work financially. We've got to hit the reset button, build up some revenue, and then just bring it back in a different format. Mm-hmm. So we did end up doing that, sold all the property and everything. And so what happened was then I shifted I went back to the ED. So I was working, I am still PRN. So I work now 2 days a week, but mm-hmm. at that time I went back to like 2 to 3, it was flexible, which was cool. And at the same time, focus on the media company. Mm-hmm. So, and that's kind of the situation I've been in since then. So that was the end of 2018. We're in mid 2020 now. So I've been just focusing on building the media company and helping clients, focusing especially on healthcare facilities, helping them grow, bringing in patients, helping them grow from the ground up. Even if they don't have anything yet, creating a name, creating a logo, choosing the right website address, designing everything for them from the ground up. And that's really exciting because you're able to help people grow when they have nothing to start with except for their licensure as a doctor or nurse practitioner. So that's what we've been able to do since then. And so I'm still working 2 days a week in the ED. And my goal is to reopen the nonprofit next year sometime.
Oh, that'd be really cool.
Mm-hmm.
I love actually what you're doing because it is so needed. So many medical professionals do not know how to grow a business, right? Mm-hmm. And you need to know how to grow a business. So I'm curious, how do you feel like your experience as a nurse kind of is helping you right now in the media company? And I would love to talk also about your plans for the future, but how do you think right now how is being a nurse helping you right now in that?
Yeah. Yeah. The cool thing about nursing is you work directly with the people you're helping. So you're not stuck in a cubicle. You're not an MBA just strategizing from the bird's eye view, but you're actually directly with the people that your decisions impact. And so with the media company and with every business, I always felt it was really important to directly talk to the people I'm helping. And I think that's what it is. You get kind of an organic, we had talked, I think yesterday about intuition. You get an intuition for what people's needs are as a nurse. You feel what they're going through, you feel what they need, and there's just something that's kind of guiding you because you have that gut feeling with either, this is the way I need to go in creating an experience that's going to be in their best interest or a service that's in their best interest. And then also you can feel like how your decisions are going to affect people, which is really critical in a business.
Yeah, absolutely. Wow, I love that. What do you see for the future? You mentioned you want to reopen a nonprofit. Any other things you see also in the future for nursing in general? Would love to have your idea around that too.
Nursing in general. I think more nurses are going to become entrepreneurs, really honestly. We live in the gig economy now. They're estimating within a few years, I think by 2025, up to 40% of Americans are going to be a part of the gig economy. Wow. And that's kind of a foreign term to a lot of people in healthcare, but what it is, anybody can have any sort of skill. There's so much more access to online education now. You can learn something simple that's not that complicated and then offer your services to somebody, even if it's as a subcontractor or freelancer.
Yeah. And so how do you see nurses do that? I'm curious because especially you are there are some nurse entrepreneurs, but there's a lot who are not. And there are nurses out there who right now, I'm sure, are saying like, wow, I have an idea or I want to do something different, right? What would you recommend to them?
Well, I would recommend finding what you're really good at, what you absolutely love. For me, it was more of a need and then just hiring the people that had the skills that I didn't have. Because I had to have an addiction psychiatrist who's board certified. I had to hire a master's level therapist. I didn't have time to get all that training. But the cool thing about starting a business is you don't have to learn everything yourself if you're going to do a business where you have employees, but you don't have to start there. You don't have to start there. What I would do is make a list of what you really, really enjoy, because there's aspects of your work now that you enjoy. There's aspects of things even outside your work that you enjoy. So I would make a list of those. So for me, I love helping people. I love personally growing. I've always been a big reader. I love to read and grow personally. And also, let's see, what was it? Productivity was one of the things I've always enjoyed, like maximizing my time. And then just being like managing my finances effectively. That was something that personally was really important to me before I ever started a business. So I was like, that I guess kind of feeds in to, okay, these are areas that interest me and that I enjoy improving upon. How can I apply that to life? How can I learn skills that I would be able to maximize that to help other people? Another thing that I've always really loved as a nurse is education. I always loved teaching my patients and helping them. So that's something I get to do now. I get to have a podcast where I teach people how to use LinkedIn effectively. I could teach my clients, every client that I work with the growth agency, I help them to make their business more effective, make it more profitable, make it more efficient, teach them how to hire people in a way where they have a healthy culture and they're not running around working 70 hours a week, but instead their staff are able to be empowered to make decisions that drive the business forward instead of the business owner doing everything. So that's what I love. So there's things that you love. I would list those things and then talk to somebody who's been down that road before. It's a heck of a lot easier to learn from someone else's experience and mistakes than it is to make them all yourself.
Yeah,
There, along those lines, there is a one recommendation I would make with finding your path would be to talk to a company called SCORE. I'm actually a volunteer there. It's all volunteer organization. It's a part of the Small Business Administration, but there's thousands of chapters across the US, and people can talk to them and find out, how do you create a plan for a business? How do you decide what kind of business to create? How do you test it scientifically to find out, is there a need for this? And would people appreciate this type of business?
Beautiful. Awesome. We'll put all those websites down below as well, so you can find them. I'm curious. Well, two things. Well, you talked about your nonprofit. Just wanted to really see, what are your plans with the nonprofit? Is it going to be restructured or the same thing? What's your plans with that?
Yeah, we have the basic core because I still have all the policies and procedures, and I would say I'll probably reduce the complexity of it by 80%. I just have a tendency to make things so complicated. And that's just, I don't know what part of my brain that is, but I don't know, maybe it's the analytical part. But the really important thing about a business that I've learned in the last couple of years, I've been devouring books in the last 3 years since all this happened. I'm like, what can I learn to make sure this doesn't happen again? And obviously there's no 100% certainty on anything in life. But one of the things that I've learned is if you focus on the first principles of what the business is, if you get the core of it right, just focus on that, you can always make things more complicated later. There's nothing holding you back from that, right? So if you get the core of it right and it works, focus on what makes it actually work in the long term, which mainly is revenue and, limiting costs, then you're good. So I think the way that I'll do it later is I'll focus just on housing in my area. That's probably the biggest need. The two biggest needs would be housing for people who are struggling with addiction. They need to get back on their feet, have a place to live, be in a healthy environment with people around them that actually want to be clean from drugs and alcohol. And then also learn the skills in life that they need to succeed in the long term. So my facility was faith-based, and it will be faith-based in the future. So I have a Christian background, and that's what I've seen make the biggest impact in people's lives. They have a miraculous change in their lives. And then the growth that they have personally is very accelerated compared to traditional 12-step programs. And obviously everybody has their own philosophy about it, but that's what I've seen make a powerful impact. That's what happened with my dad over 35 years ago when he changed his life and stopped using heroin and cocaine and alcohol, which he'd been addicted to since he was 14 years old. So, so that's the background that I have, and that's the hope that I bring to other people, because there's still people alive today that wouldn't be if we hadn't done the work that we had done.
Wow. David, that's an amazing story behind all of that too, right? And part of motivation for what you're doing as well. Wow.
Yeah.
I'm curious as we're wrapping up this conversation. How do people get in touch with you? First of all, if you're listening, we'd love for you to share this video to another nurse, another person who needs to hear this, right? So I'd love to hear, how do people get in touch with you? What's the best way?
My agency site is digitalismedical.com. And then my podcast is linkedinsiders.io.
Beautiful. And LinkedIn, you're really active on LinkedIn as well. That's how I found you as well, right? So
yeah, that's how we connected, which was cool. I dabbled in it for years, but I really figured that out and how to work it really well during the quarantine. And so then I decided, well, I might as well. I actually had a business coach that said, you need to use this to be able to help other people, because other people, they're stuck with networking and cold calling, and that ain't working right now. So I said, well, I might as well help people with that. Yeah.
I love it. I love how you done it. So as a last tip for nurses who are watching right now, right? Because this is really specifically going out to nurses. And like you said, we need more entrepreneur nurses. We will have more entrepreneurial nurses, whether it be in a nursing practice or in the other nurse-led businesses, whatever it may be, right? One last tip for someone who's listening right now. What would you say to them?
I would say for someone who's thinking about starting a business, you don't have to dive in head first. What I would do is just hang out with entrepreneurs, regardless of whether they're nurses or not, especially nursepreneurs, but hang out with entrepreneurs, get inspired by them, because they're very exciting people to be around. They're so full of ideas, so full of life and energy. Break out of the box, hang out with some entrepreneurs just to understand how they think, and you'll start getting inspired. You can take one step at a time. You don't have to dive in.
Nice. Okay, we'll stay with that, David. Thanks so much, guys. Thanks so much for being on this interview. It was a wonderful interview. Lots of insights in a very new field for nurses, but I think, so needed. So thank you so much for coming on here.
Thank you.
Okay. For everybody else, please watch again. Please share this. Please give this to another nurse who wants to hear this, who needs to hear this. Comment, and please share this, guys. And we'll see you soon on another episode. Thanks, guys.